Okay. Hello, I'm Vivek Majumder. I'm a fifth year medical student at the University of Edinburgh. For this Medicine in a Nutshell video, I shall be interviewing Mo Harris at CT1.
Hi.
Hi, nice to meet you.
Andrew.
So we'll start off, this is from a medical student's perspective. I think this is the question most of us want to know the answer to, first of all, is will we survive FY1?
Of course you'll survive. It doesn't feel like it's all the time when you're doing it, but of course you'll survive and you'll learn from it and you'll take a lot from the experience. And with any new job, even now when I do a new job, it takes a while to get used to it, but you live and you learn and you go forwards and of course you'll survive.
Well, definitely a relief then. What's the application process like?
So the application, obviously you need to do at medical school. It's a points-based application with the foundation programme. So once you have decided that you either want to go down the academic route or just the foundation route, you make the applications. It's all done online. It's actually really well laid out and it's really easy to use, but obviously you need to keep up to date with your timeline so that you don't miss any important dates. You need to make sure you get your references and you need to gather together all the points, so you need to think of times when you've been given merits at medical school, or you might have additional degrees, things like that. So you need to make sure that you think of all aspects of your medical school experience and try and utilise all those points there to get you the best standing. And obviously that combines together with your SJT score, and then you'll be ranked with all the other medical students in the country as to where you get your job.
Right, okay. So what's the jump like from 5th year to FY1?
I'm not going to lie, it's quite daunting. And the first day of being an F1, I remember I was on orthopaedics in a hospital I did not know, with patients I didn't know, with staff that I didn't know, and I was on call and I had to carry the crash bleep. And I remember going for a wee at about 4 o'clock in the afternoon, and the crash bleep went off and I absolutely panicked because I didn't know where to go. But I did it and I went, and you just do, and you have to remember that you've always got support of all your other team members there, and that it is scary, it is horrible, and you don't want to eat breakfast that day because you're a bit nervous. But yes, the jump is difficult because I just try and think that when you're a medical student in 5th year, take every opportunity to do what you would do as an F1, like towards the end. Obviously you've done your exams and things like that, and all medical schools work differently of when you do this. But take the opportunity to do a ward round, to shadow an on-call, to do a night shift, just so that you know how things work. But I think it will depend on whether you move hospital or not, and I did. So I made it just slightly more difficult for myself. But once you've done the jump, you will feel so pleased with yourself that you've done it, and then nothing else will seem as difficult.
Okay, so can you describe the typical day of an F1?
So the typical day as an F1, you will obviously go to some form of handover, so take a handover from the night team. You'll always discuss perhaps acute patients or those that are sick that need some immediate attention. You will then conduct a ward round, and this can, even as an F1, be on your own, but you just need to think sensibly, look after your patients, talk to your nursing staff because they know your patients better than anyone really. So you'll do that, and then you'll conduct a list of jobs that you need to do throughout the day, and you just, the most important thing you do as an F1 is you learn to prioritise. So you prioritise your sick patients or your important jobs if they need to go to theatre, things like that. And then you make sure you do a very good handover at the end of the day as well. So and importantly is take breaks, because I remember the amount of times as an F1 I felt so busy that you couldn't take a break, but actually you can. You're only one human, and you've got your friends, your team members and things like that, so you need to be able to use the whole team and basically just do the best for your patient that you can.
Okay, so what kind of specialties can you be put in, and is there a massive difference in your job?
So when you apply for your F1, F2 jobs, mine were linked, but I know that some of them aren't. You have to reapply for F2 once you've gone through, started F1. And I chose my job based on what I wanted to do later on. So I know that I wanted to become a surgeon. So my foundation jobs had quite a lot of surgery in them, including paediatric and plastic surgery. So basically you get a very complicated spreadsheet of all the jobs, and I spent a long time on Excel, colour coordinating all the jobs, and the ones that I didn't want to do I put in red and put in the bottom. But it does take, and actually that would be my one piece of advice, is when you're ranking jobs, take over a week, take as long as you can doing it, because you'll realise at the end that you're really rushed and you're not quite sure what job you want, and if you rush that, you've got 2 years of doing a job that you might not necessarily want to do. So, but yes, you can definitely pick out specialties very early on if that's what you want to do.
Yeah, and in terms of picking, how did you choose where you were going to do your F1?
I always wanted to come to Yorkshire, and I like the outside, I like going walking, and I've been visiting Leeds before and I really enjoyed it. So I only ranked Yorkshire as my choice, and then I ranked my jobs within Yorkshire. So you can go wherever, and I'd almost advise it in a way of moving somewhere new if you want to, away from medical school, and give yourself a new challenge of working with people that you wouldn't have worked before, and systems that you don't let people scare you. The fact that you won't know the computer system or you won't know the hospital layout. You learn those in 5 minutes, because really they're the same everywhere you go. But if you want to go somewhere, don't be scared to go ahead and do it.
So one of the major fears, especially of my generation, is losing your work-life balance.
Yeah.
Can you tell me about that and in relation to F1?
I mean, I'm not going to lie, you're not a medical student anymore, and I had a good time at medical school, and you've got a job now, and you do. But no, and in a way, you create an incredible community, and because you're all, as an F1, nobody else knows what it's like to be an F1 unless you've been there, and so you do create this incredible friendship group and this incredible link to these new friends that you have. And so no, I found that, I still, yes, okay, you do have to work weekends that you didn't have to work before, and times change and you have to work some Christmases that you probably didn't have to work before, but ultimately no, you don't really lose it, but you just have to be proactive in doing the things that you like doing, and really you should, because work can be really hard and long days can be tiring, so you need to have a proper break.
Yeah, so would you say you definitely have time for example, staying in touch with your uni friends?
Definitely, yes. I've recently just got back from seeing all my uni friends, so yes, you definitely don't think that your life is over once you become an F1. It probably will be for a good few weeks until you get your feet grounded, but no, you don't ever lose that. And like you say, you've been through so much together at medical school. It's great to get back together and discuss how you're all getting on and where you all want to go. My friends and I have all done different things: surgery, medicine, GP, psychiatry, everything. So it's interesting to hear people's different opinions. So
every year in med school we get slogged with new information and new things to learn.
Yes.
What kind of things do you learn in F1?
Oh, that's a difficult one, because it's very much more the practical skills. It's very much more learning to be organised, being on time. It's learning things like cannulas, catheters, ABGs, how to look after a sick patient. So it's more of a very acute sort of learning, like common acute presentations and things. But you should have F1 teaching as well. But for me, it was learning how to look after unwell patients, which I think I wasn't necessarily as exposed to at medical school as I was as an F1.
Okay, and do you have exams?
I didn't sit any exams during foundation year.
I think that's a relief to quite a few people right there.
You can choose to sit. I know as doing surgery myself, I haven't sat my MRCS yet. I'm doing that in the next couple of months. But there are people that choose to sit those during foundation year. So really, that option is just up to you. But there's no pressure in foundation year. You obviously need to complete your ARCP, which is an accredited check that you do after each year, so foundation year 1, foundation year 2, because obviously you don't have your full licence until you're a foundation year 2.
Mm-hmm.
But no, there's no formal exams.
There's no formal exams. That's it. Great news. Fantastic
You've
news.
had enough of them.
So, do you have any advice for the terrified medical student that has F1 staring down at them?
Don't be scared.
Yeah.
Just enjoy it. Well, it is scary. No,
Yeah.
I should say that. It is scary, but take it as a lesson. Learn from it. There are people there to support you.
Mm-hmm.
Don't be scared to ask for help.
Okay, and what's your advice for a new F1?
For a new effort, what do you mean?
So, that's for a medical student. For
I'd
a
say-
new F1 who's just started the job, would you say the same things?
I'd say exactly the same thing.
Great.
Just ask for help and don't worry and just try, and you're only one human, you're one
Mhm.
person, and you can only do as much as you can.
Thank you very much
Thanks
for having
so
a chat with me.
much.
Thanks.
Thanks.